because some of these patients or even they will be unable to leave it. They will tell you, if I don't do it, then this is what's happening to me. So they need help to be able to overcome that dependency.
Okay.
Yeah.
Okay, so to our second last question is about supplements and herbal medicine. If you go around town, you go around somewhere, you'll definitely see these things about herbal medicine, claiming to heal all chronic types of diseases from cancer, arthritis, all manner of conditions. Then there are other companies that are coming up with supplements, saying if you do this, it will even regenerate your neurons post-stroke and all that. What do you think should be the approach towards this marketing? And should the Pharmacy and Poisons Board look into it in terms of market surveillance, market authorization? What's your take about that?
I think those are quite a number of questions in one. But on the issue of herbal medicine, I know even there are TV stations dedicated to herbal medicine.
True.
And they have these magical promises. You take this one, you will, if you are barren or infertile, it will work for you. You know, they select very those cases catchy. If you have cancer. So, you know, where patients are desperate to get out of these conditions, diabetes, hypertension.
True.
They will also talk about, you know, issues to do with weight. So, by the time you are trying this herbal medicines or supplements, they are also very pricey. So you will be shown a picture of someone who tried it and it worked. Some are marketing gimmicks, and it's quite misleading. I am not saying that supplements are bad. They are good. We use them even for various reasons: appetite, immunity, blood building and all that. But it can, you know, it's another market that has been so much abused simply because anyone, you know, when I left college, there were so many network marketing ventures, and they focus on health.
True.
And they tell you, you take this coffee, it has something.
True.
Well, that could be true, but they do not tell you how long is it going to take. You taking that coffee worth that much to feel any change in your health or in your. And they do not tell you if there will be any side effects. In fact, most say they have no side effects.
Sure.
But even plants have drugs in them. So you cannot say that there will not be, you know, you'll not get side effects. Exactly. You will. So it's really sad that it's more of a business than healthcare provision. And the target is how much can I make, how much can I sell, how many people can I convince to be my downlines, so that we get the millions. And then without really getting to be concerned about the patient, I sold a packet of, you know, slimming something. How sustainable is this to this patient? I should educate the patient. If it is, the packet is 2,000, is this patient able to take this for the duration that maybe the results should be realized? But you see now, the focus is the money and the match that they can make. I know there are people who are genuine and have genuine products that are also approved by the board and they are standard, but really there is there is a big, quite some big gap there in terms of also regulation and standards, the issue of standards. So I think it's important that we don't just go to either herbal medicine with the mentality of that magical effect. Someone has diabetes. There are many ways, or there's diabetes type 1 and diabetes type 2.
True.
Type 2 is an issue of lifestyle. There are things you can do. You can change your lifestyle, stop eating all those sugary things, exercise, have enough sleep, stress levels and all that. And also take medicines that maybe the doctor will give to you. But you see, some of these herbal medicine practitioners, they will even use their herbal products in addition to the other conventional drugs.
True.
So you will not even know which one worked.
True.
But they will tell you that it worked. But you see, people don't. You know, they are also put in like capsules. Others are tablets nowadays. Those herbal products. Others are pastes and all that. So you will get a capsule that is a herbal, and then you'll be given. That's what's happening. They will give you now another conventional, maybe antibiotic. Maybe pain reliever. You know, like I said, they are much more into making money than helping people and supporting the healthcare of the citizens. So there is need to have a proper regulation. I think there is a flood of every other supplement. And I am not discrediting that supplements are important, no. But I'm saying it's very, very important that we have trained personnel taking care of our health.
True.
Even if it was your vehicle and you went to a garage and then you know the way mechanics will come to your vehicle. You want to be keen to know who is this competent mechanic here. Otherwise, if you leave your vehicle, everyone to tell you what to fix, you will end up spending much more and even maybe having your vehicle spoiled. It is still works the same. We have anyone who left college, you don't have a job, let's go and sell supplements.
True.
That person doesn't know how the supplements work or what he's now trying to. Of course, now we have internet, but it is better to have this care being given by the trained personnel. We have pharmacy professionals who are duly trained and qualified and authorized to practice by the Pharmacy and Poisons Board.
Wow, that's you have really explained it so well that I don't think there is anyone else can put it that way.
Sure.
The reason as to why I asked you that question is because some 4 weeks ago we had a patient who had a very severe arthritis, all the way to stage 4. And this patient was told to go and boil grass, nyasi, and that will solve the problem. So the woman had consumed that boil the grass for almost 6 months, but she also ended up into replacement. So I was really concerned about it. Now to our last question.
Maybe as I finish, I said, supplements are good, very good. Even like pregnant, expectant mothers, they will need supplement because maybe like calcium. It's being utilized in the the growth of the fetus in the womb. So there is a lot of loss of their calcium in the bones and all that. So you'll find they need to be given some supplements with all those many like the calcium, the iron, blood building. That's a good thing. But it is very misleading to pick a grandmother of the village who is in a lot of pain and hopelessness. Maybe he has he's able to buy the supplements, or he has kids who can buy. But now they're doing this out of desperation and maybe misinformation. I am not saying that we do not have supplements that can help in arthritis. They are there. Or whatever it is, they are there. But you know, they also don't really will not work in isolation. There may be some other therapies needed to help this patient. So if a patient or if a grandmother has to go boil grass, that is like witchcraft.
Come to gear 5 liters.
It is punishment, and you are just making them have deteriorated health. Which is will now make them go for other procedures, like you said, replacement. So let's be careful. And that's where now regulation comes in, because if there is a herbal outlet and it is authorized by the government, then that should give you some confidence that whatever is in there is a standard of the highest quality. You know, the Constitution of Kenya guarantees health care to all, of the highest standard to all. So it's the responsibility of the government through the regulatory bodies to ensure that the public is protected. But now we have herbal outlets with non-trained, non-certified professionals. We have herbal outlets with someone who is practicing from maybe the old days of which herb was doing this. The orthodox. You know, like we call it, is it a guesswork or just empirical therapies? So it becomes a very, very expensive affair to the patient, and there should be some check, and there should be the right people doing the right work. Don't mislead people that you have cures just for the sake of it. Let people do things that have been proven to work and to bring solution.
Wow. That's a great insight. Now to the rest, this question is about they call it Viagra, they call it blue pill. I heard even the campus students are using it. They are calling it give me 100 mg. And we have seen in recent years it has also been the cause of death to some extent. So what would you say about these blue pills in terms of should they just be dispensed without prescription? How should people go about it?
First, it shouldn't be dispensed without a prescription. But I know that's not the case. No, reality is just reality. It should, you know, it's a drug that is used for even other things other than erectile dysfunction. It's also used for heart problems. I have even prepared it in the hospitals I mentioned. We do a preparation where you will to be used by maybe a kid with a heart problem in ICU or something like that. I mean in critical care, not necessarily ICU. But it's very, very important to have, you know, use it if it is needed. And it is needed if it is prescribed. Not because you feel that you need it. Actually, some of these guys using the blue pill, they use it not because they are not functioning well. Some want to use it maybe to experience or to have that experience or to see the magic of the blue pill. And then it ends up working against them. And that's why you've had, there are many who have maybe died after using it. Because if you have a problem, it is okay. Go to your medical care, that is healthcare provider, see a doctor, a clinician, get a prescription.
True.
We usienda useme nowadays I am not able to rise to the occasion. So I hear there is a blue pill and you don't know. Maybe you could even be having a heart problem and you don't know. Now when you take it, what's going to happen? You've taken maybe the highest dose. The ones asking for 100 milligram. And there are young people who are supposed to be energetic.
Very young.
There are many ways of that can, help anyone, the men, rise to the occasion without really using the pill. And there are reasons why they may not be able to do so. Could be they are stressed up, they have issues that are weighing them down. It is natural. It is just the way the body responds. Maybe they are also afraid. They are not confident about what they need to do. Those are some of the things they can discuss with a healthcare provider. But then when you resort to the blue pill, you don't know when it will be, when maybe your blood pressure will be too high and it will, now this one will work against your system. So it should be prescribed. It should be used where there is need. And it should not be used just for the sake of it. In fact, it is for many it's psychological. Because they'll buy it and they want to use it 2 minutes, just swallow it like 2 minutes before the activity. Literally it doesn't work. Because it needs to go into the system, be absorbed, and now be able to work. You should take it even 2 hours, 1 hour before that event. But then you find someone has bought and now he doesn't know when that time will be. So he just takes it and goes to the activity. So it did not help him. It just got into the system and did not achieve what it needed to achieve. So I discourage, especially young men, just leave it. If you start using it now,
you're done.
What will you do when you are literally now you need assistance?
I was talking to one young guy who uses it.
Eat well, and
I was talking to one guy who uses it, and I was asking him why he uses it. And he told me, in fact, he is not the one who buys it. It's the girlfriend who buys it for him. And that gives him psych in terms of performance and all that. But he also discussed he once bought it, consumed it, but the girlfriend didn't show up. So I didn't know what happened after that. Okay, so now to the last
even others will get what we call priapism, which is erection, and it's not resolving, like it's not going back. So someone will tell you, I took this one, I was not able to leave my house
because of ABCD.
Because now it's still it still arrived to the occasion. So that's why I'm saying it's important to take it upon advice and a prescription from a qualified healthcare provider. Otherwise, the risks are there. And you see why people will maybe even die is because he doesn't want to, he will not be able to, you know, it will be like an emergency now. He can't be able to go and look for help or even shout for help. Maybe they're in a room with, you know, a partner whom they would not want that matter known to the public.
True.
Yeah, and then he should just get there.
Well, so now to the last thing as we conclude is about what do you think now should be done in terms of policy, in terms of laws and all that to regulate the way we operate in the pharmaceutical industry in Kenya?
Number one, I must admit that we have a challenge in the pharmacy sector with what we call quacks or charlatans. We have people who masquerade as pharmacy practitioners.
True.
That is aided. It's a two-way thing. It's aided also by professionals. Because if I am a professional, I open a pharmacy, then I leave it to you or to someone who is not a pharmacy professional. What they do is they will continue dispensing. They will continue doing what they are doing. So I know the Pharmacy and Poisons Board has really been trying to control that, especially by ensuring that we have no non-pharmacy practitioners allowed to open pharmacies. But we still have many who will open even without the licensure by the Pharmacy and Poisons Board. And even the county governments, sometimes I think they are also to blame. There should be a mechanism where, you know, the county government doesn't give you a license for a pharmacy if you do not have an approval, or rather a license from the board, the regulator. But you'll find someone has a license for a pharmacy from the county. So we may have a challenge in the drug inspectors in the country. They may not be as many to go to every pharmacy in this country. And that means for some time this guy can always operate. He has a license. The county government council, when they come, they just want to see their license. But if there was some joint efforts, then it would mean even, sometimes we think even you take it to the landlord, like, you know, health is very important. Because you do not know who will buy medicine from that pharmacy. It could be your brother, your relative, and like you said, the case of the woman who got
rashes, adverse eyesight,
adverse drug effects. It's, you know, of course, I may not want to blame the pharmacy practitioner who issued it, or even the patient, because I think I also followed the story. The patient said she was not aware she had any allergy. So usually, even when you go to see a doctor or to a healthcare provider, they want to know the history. And they will ask you, are you allergic to anything? So you may not know. It is not a crime, but if you know, then you say you are allergic to something. And maybe that never happened. And what now came up is those adverse reactions. I know many other cases that have happened, but we should try the very best to ensure that we don't have such cases. So the regulator needs to strengthen the inspection, and even I mean, you know, I know even the DCI would be of help. Because now, when you have a pharmacy and it has no license from the board, it is now a criminal activity. And you are endangering the public. Maybe you're an accountant or just a businessman, and you're the one now masquerading as a pharmacist or the farm tech in your area, that should be discouraged. If there is no licensed personnel in the pharmacy, then it should not be operating. Yeah.
Wow.
Others will use their family members. I would have a pharmacy, then I bring my brother. I train my brother how to dispense this pain. You know, these are things people can learn, but they will always do the right thing until one day when they do the wrong thing that will cost a life or lives. So why should we allow that to happen? Yeah. So regulation, of course, also training, like I said, for the Kenya Pharmaceutical Association, we also have platforms where we keep having trainings for our members, so that we are updated on the current trends in the pharmacy sector and in the health sector. So that should continue happening even through, you know, as a requirement by the regulator to have what we call CPD, or continuous professional development. That the fact that I graduated a number of years back doesn't mean what I got that time is still what is available. Things are changing. Drugs are also being recalled from the market. Others are being, you know, banned and all that. So, and other treatment, maybe the way we, a practitioner used to maybe prescribe, the protocols have changed. So that's why we need to keep being updated.
Wow. Now to your parting shot to that person in the community, what would you tell them as your parting shot?
I would tell them your health is your wealth, and if you know, if you don't take care of your health, then it means even if you have the wealth, you may also not be able to enjoy it. You may not be able to do many things that you would have done. So let's take care of ourselves. Let's do what we call testings, early detections. Early detection is when you go to a healthcare facility for some tests, screenings, like cancer screening, breast cancer, prostate, all those. Let's not wait when things have deteriorated to go. That's the time we want to go to the hospital. Even blood pressure, just go to the chemist nearby and unapimwa BP. If it is okay, then hakuna shida. You're good. If it is high, then you know how to maybe go on from there. The issue of you know, the early detection, that is, you will avoid many other complications, because there are things that can be stopped or can be treated when they are discovered in good time.
Wow, so thank you so much, Dr. for your time. We really appreciate. I know your schedule is a bit tight, but you got time to talk to our audience. So thank you so much.
Thank you.
And you are most welcome once again.
I will be back again.
Okay, thank you.
Thank you so much.